You want to help the whole patient.
Yeah.
So that's the language we want to have. Only don't do it if they're insistent. They don't want to worry about it right now. Maybe it's money, maybe it's time, whatever it is, the reason that they're like adamant, no, I don't want to talk about that. Okay, great. But don't push it. If they're bringing that up, oh my goodness, how long have you been dealing with that foot pain? How long, is there an injury? You're asking some questions about it. It only takes a few minutes, right? Just ask some
Mhm.
questions to get more information about it and say, we can absolutely help with that. So while you're here today, let's make sure that Dr. Martinez does an exam and he can take a look. And if she's like, no, 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 I don't want to worry about that, blah, blah, blah. Okay, then yeah, you can bypass it. But I always assume the sale, right? I always had
Mhm.
that really assumptive language of, you're here. Let's take a look at that, right? That's what I would do if they came in for neuropathy, but they had low back pain. Oh my goodness. Like we help patients every day with disc issues. Like let's include that today. No charge, but let's do an exam and see if that's something we can help with. So because you want to help the whole patient, right? So
Yeah.
that's the language we want to have. We only don't do it if they're insistent. They don't want to worry about it right now. Maybe it's money, maybe it's time, whatever it is, the reason that they're like adamant, no, I don't want to talk about that. Okay, great. But don't push it. The
Okay.
only time I prioritized it is like with decompression and neuropathy, that's a lot. I mean, that's easily a $14,000 care plan sometimes, right? And
Yeah.
so if I felt like finances were an issue, like they had talked about it, they've mentioned it, they whatever, then I might think, okay, I know that money's an issue and I know that both of these are really severe. So I'm going to ask
Mm.
that question. And that way I have a care plan ready that just has one. You
I
know what
see.
I mean? Because I very rarely offered options. I only did that if I knew budget was a huge issue. And so I say, you've talked a lot about your feet today. You've talked a lot about your low back today. If you had to pick one that just is bothering you the most, what do you think it would be? Or what do you want to prioritize? Or I don't really like asking to prioritize, right? Because ideally I want them to do both.
Yeah.
And sometimes clinically you have to suggest something, right? They can't
Mhm.
always choose. Um, but but yeah, so that's the only time I would ask them what their priority is.